Hello and welcome to Community Health Journal. We begin today with a growing epidemic in our country that is severely impacting more than 2.5 million people. Addiction to heroin and prescription drugs. Washington Senator Patty Murray recently visited Cadlick Regional Medical Center to highlight this serious issue and what's being done to combat it.
I started using just once in a while, and I was using daily within a month or so. With my maximum dose at the peak of my use being approximately 900 milligrams a day, which if I were to take that now, I'd be dead.
There is no more powerful way to describe the severity of an addiction than to hear from someone who has had one themselves.
I now live a normal life. I work just like you. I raise my kids. I'm working on building my trust back for all the lies that I've told and the people I've betrayed.
Senator Patty Murray is championing federal legislation that would bring desperately needed resources to this growing epidemic. Policy changes by Congress have helped. Now the task is securing the funding to pay for services to treat the 2.5 million people across the country addicted to opioids.
It can happen to anyone, and it is everywhere. I travel across our state. I have talked to family after family who've been impacted, mothers, fathers, seniors, young people who have tragic stories about the hardship that this crisis is causing. And when I speak with local sheriffs and police chiefs, they all say they are often the ones who are most often responding to this crisis. And too often that those struggling with addiction are left to cycle in and out of a criminal justice system rather than being put on a path to recovery.
The director of Cadlick's ER sees firsthand what can happen when someone becomes addicted. It affects people from all walks of life.
Now, in my career as an emergency physician, I've seen countless numbers of people affected by the scourge of opiate addiction and drug abuse. These are among the most vulnerable in our community, and it is in this community. It's not just the people in the emergency department. These people in our streets, in our schools, in our places of work, in our places of worship, they're throughout our community, and they cross all levels of the society. Most of you probably know somebody who struggles with this, and you may be surprised who they are.
Dr. Jeff Allgaier is also an ER physician who has founded a company called Ideal Option to treat addicted patients. Dr. Allgaier's growing practice cannot keep up with the need.
The fact that heroin and pain pills have fueled an epidemic where drug overdoses now cause more deaths than automobile accidents highlights just how important it is for us to continue to work together in this fight against addiction.
Today, Michelle is committed to a clean life, dedicated to her family and rebuilding the trust that was taken away by her addiction. Senator Murray says people like Michelle are extremely courageous.
Because I believe it's going to take all of us together to deliver the resources we need and the help we need to make a real difference for so many families here in the Tri-Cities and across our state and country. So I really want to thank everyone here who's involved in helping us out. And I want to say again, I especially appreciate Michelle, who can put a personal face on an issue that touches all of us. So Michelle, thank you for being here.
Thank you. Joining the program and changing my life has helped me to become a better girlfriend, a better mother, a better daughter, a better employee, just better all the way around. And without the Subutex and without the program and the support that I get from everybody there, I'm not sure where I'd be.